Mr. Costa Abuaje, who is the CEO of the National Health Insurance Authority. He took over from Dr. Bernardo Koboy, and for some months now, he's been very, very active within the media. We've had issues of the health insurance coming up. We've discussed it a couple of times, but today we're spending some more time with him to understand exactly what's going on within the insurance, and he seemed to have also some drastic introductions of policies that's coming through, and you may want to understand exactly his plans for the insurance. And let's see how Ghana will take or go forward with his arrangements and the new policies that he comes into force with. Let me just tell you a bit about the man that we are actually here to speak with. And I want to let you know that he was actually the Director for Health Promotion at the Ghana Health Service. He took over from Dr. Koboy, and then he also he was nominated for the Health Ministry, and that's how Dr. Abuaje came into also this space. Well, in a letter dated February 27, 2024, and signed by the Secretary to the President, Nana Asante Bidietu, Asante. Yeah, he also explained that the appointment was in pursuant to Section 14+1 of the National Health Insurance Act 2012, Act 852. So the appointment was done in the constitutionally required advice of the board of the authority, giving the constitution or the consultation with the Public Service Commission. Well, Dr. Abuaje also holds a PhD in health insurance scheme research from Leeds Beckett University, obtained in 2016, a master's degree in public health and health promotion, obtained in 2010, and also from the same university, a Bachelor of Science degree in the chemistry from the University of Cape Coast, obtained in 2006. He also obtained higher national certificates in the pharmacy technology from the Kumasi Technical University in 2022. The man in question brings some, experience as far as insurance is concerned, so he would have the chance to tell us more about it. And at this point, you're very welcome to the program, and thank you for joining us.
Thank you, Annie.
How has it been so far when you took over?
It's been hectic, but we are on. We've tried our best, and we'll continue to do our best for Mother Ghana.
When you say it's been hectic, where?
It's a very big institution, and we are a beacon of Africa in terms of insurance, because a lot of countries look up to us. So you see a lot of...
We're the beacon of Africa.
Yeah.
How did we get there?
Okay. So, Ghana's model of insurance is one of the best in, obviously, not only Africa, but the world. So a lot of people come to study how we're doing. In fact, just yesterday, the South African ambassador called me that South Africa will want to come here and study what we're doing in Ghana so that they can take it back home, because their president announced that they want to go the Ghana way of insurance. So, we've been 20 years, and the fact is, we've done well. And here, let me pay tribute to all the CEOs who have actually served this institution. The recent ones that I can remember, I think Dr. Ano from 2016, then Dr. Selby, then Dr. Bernardo Koboy, whom I took over. He's now my boss, the minister. They've done their parts. They championed a lot of strategic policies that's obviously helped the insurance. But I think, as you were reading my profile, I bring on board the expertise of insurance, being it's within the health insurance. This is what I studied. So from 2010, I've always been doing my research in Ghana here, looking at some of the gaps within the insurance space. And I think I completed in 2016 when I was awarded a PhD in the National Health Insurance of Ghana. So I've been a consultant in many countries, supporting their social and social insurance schemes. And like I told you, I'm an external examiner for big universities in the UK, University of Salford, where
you still mark papers, examination papers?
Yeah, I examine PhD students. In fact, recently one of them finished University of Salford, where I was the external. I'm also external to London Met University, where I marked their public health and health economics and health policy papers. So as an external, you take oversight on what the lecturers are doing to make sure that they are doing it right.
Yeah.
Yes.
Well, when you took over, you one of the things that we also followed through with you was your 4 key point vision for the scheme. And one was to eradicate illegal charges, reduce NHIA ICT. The third one, enhance NHIA benefit packages, and also institutionalizing mandatory NHIA. These are all very huge policies if you want to pursue. First of all, have you started working on them?
Yes, I will say that you are right. When I came in, I looked at the strategic document, and I looked at the PhD work as well. So I took it to the board that there are things that need immediate attention, some reforms that we really need to do as soon as possible. And the board accepted these, and we are continuing with it. One of it is what you said, the illegal payments. And if you talk about the illegal payments, I mean, it's been with us for 20 years. And I think it's time for us to address it head on. And the proposal to government is that we need a 2-pronged approach. The first one is systemic, which means that we need to deal with it through our digital systems. And I'll explain that. The second one is with enforcement, how we can enforce this. Now, let's take the first one. You know, government has been going on with this digital.
That's the digital system. Okay.
Digital systems. And I think NHIS, if you see, 75% of the things we do are digital now. Previously, you heard of fraud claims and all those. Now, because of digitalization, we've been able to reduce this fraud incidents to the extent that now, instead of people queuing at the various NHIS offices for their membership, now it's not like that. You sit in the comfort of your home with the My NHIS app. You are obviously a member. Now, let's look at the systemic, in terms of the systemic approach that I talked about. The government is doing what we call the e-pharmacy. So NHIA, in partnership with the Vice President's Office and also the Pharmacy Council, have started this initiative, and it's been obviously rolled out. We are doing the pilot now, so we just come from the north. Now, what the e-pharmacy will do is accredited by the NHIA on the pharmacy platform, the e-pharmacy platform. Now, once that is on, once you are on the platform, you are able to know prices of medicine and where they are located. So, for example, if a patient goes to the hospital and the doctor prescribes something for that patient, and he goes to the hospital pharmacy and the hospital pharmacy says, we do not have this product, we will mandate the pharmacists in the various hospitals to upload the prescription on the e-pharmacy platform and direct the patient to a local pharmacy of that patient to collect it from that pharmacy. Or because of the property addressing system, the medication can be delivered to the patient's home.
Really?
Yes. In fact, that's what we do. Because now we know your address. With the Ghana card, which I'll come there, we know your address. So the only thing is provide a platform that when you go to the hospital and they say, Edroni Bini Hop.
Yeah. I mean, under normal circumstances, the hospital will direct you to go to either some pharmacies, sometimes around the hospital, to go and get the medicine.
Buy.
My question is the e-pharmacies.
Clarify it.
Yes, I want
go
to
and buy, not to go and get it.
Okay.
You see, so they tell them we don't have it, so go and buy from this pharmacy. Exactly. So things that we pay for, why should the patient go and buy?
Okay. So will the go and get it curb costs and curb timeliness of the need of the medicine?
Of course, yes. So I've come to your pharmacy. Okay, you don't have the medication. You've checked on the system. It is in this pharmacy near you. So all I have to do is place, you can even take a phone call and just phone the chemist or the pharmacist. Okay, this patient is coming there to take this medication. It's already uploaded on the system. So it's only collection. And because we credential those pharmacies, they do not have to pay. So by that, we've kept the illegal payments.
Okay.
You get what I mean? Because at the end of the day, maybe all you know, they are directing you to a pharmacy which you go and buy from their own pharmacy. I'm not saying that is it, but it's an assumption.
Allegations.
Yes, it's an allegation. So you see, so that illegal charge of you have to pay for the medicine. Meanwhile, maybe if you have just been directed and you go, you just pick it up, just like that. In fact, I've had instances in the UK where medications have actually been delivered to me home without any problem because the local GP do not have it. So they've just directed the pharmacy to deliver it to me. So it's the same concept that we are trying to introduce.
That's a whole cumbersome system to be established within the pharmaceutical industry to carry out even delivery services as well.
It's not cumbersome. It's not. You see, it's easy. It's easy. So all this is along the supply chain.
Okay, yeah,
It's along the supply chain. So what happens, I've come to the pharmacy. You do not have the medication. NHIS is paying for it. Where are the NHIS credential facilities near the patient?
Yeah.
And bear in mind that pharmacists also submit their bills to the NHIS to pay.
Sure.
So all you have to do is to direct the patient to where the medication is for the patient to collect. That's the first option. The second option is if the medication is not in the patient's locality, all you have to do is to ask the pharmacy to deliver it to the patient because of property addressing system, because now we know where people live through the Ghana card.
So my question is, the pharmacies will now know that they are offering extra services.
Do you think it will create employment for our youth?
Well, you tell me.
Yeah, it's all because you see,
because it means that they would have to, along the supply chain, as you say, they would have to involve the delivery or transportation.
Exactly. And the delivery can be just a motorcycle,
right?
Bicycle.
I mean, yeah.
You see, so it is this innovation that we think that this is where Ghana is going. So this is why I'm thinking that the reforms are now so that the various political parties will buy into and run with it. Because you see, these are very important things that we need to do. Because at the end of the day, we are mandated to serve our people. And with these ideas, I believe that some of them are taking it. And I can assure you that some of them are in the MPP manifesto. Yes, because I'm from that party. So definitely, we put some in there through the head, Dr. Muhammad Baumia. But what I'm saying is that these are not negotiable because that is what will help us curb all these illegal payments. And that, you see, moving into also a cashless economy and all those things, these are the things that we need to be doing. Because at the end of the day, if I come and I'm mandated to you are mandated to deliver the medicine to my home. I go home, you deliver. You come for your money from NHIA. And as I go on, you will see why this is important, because the Ghana card will be a factor and all the others. I will take my time to explain it so that your viewers or Ghanaians will really understand.
Well, you can go there because it has to be linked.
So no, let's think about the second approach.
Okay,
see,
this is the first one that is about the digitalization. So the second part.
So the second part
and this is still eradicating illegal charges.
This is the eradicating illegal charges. What we term as co-payments.
Right.
You see, the second point is on the enforcement.
Okay.
Okay. Now you'll see that since I came in, I've had meetings with various stakeholders, including the private sector, the public institution, which is Ghana Health Service, and also CHAG, and all the stakeholders. There's one thing that's becoming real. The facilities are telling us that the tariffs are too low. And others are telling us that there is lack of enforcement. Others are telling us that there are delays in payments of the claims. So let's look at it. Now, let's take the delays in payment of the claims. Now, if you check carefully, since I came in, we have been making a lot of payments. I'm always at the finance ministry. I'm always calling the finance minister. I'm always calling controller. Please, we need the money. We need the money to pay. We need the money to pay.
Do you get it?
I do get it. Recently, I've got 800 million.
Yeah.
I'm even asking facilities to now submit their June.
Did you get
payment.
800 million, or 800 million was assured and you got 400 million out of it?
So at the time when I was paying, 800 had been assured.
Right.
But now I have 800 million.
Okay. Now you've gotten the
Now
800
I
million.
have 800, and I've paid about almost close to 450 upwards. But I'm looking for, you see,
Of claims.
of claims.
Marking how many percent, what percentage?
Okay.
From 100%.
Let me take my time to explain. You know, we work on a 3-month delay system
Yeah.
because we have a contract with our facilities that you have to submit your claims within 3 months.
Yeah.
Then we pay. So within that 3 months, we have to pay. Now we are in September. So that one, early September. So forget about that. Let's talk about August.
August.
So we owe August, July, and June. Is that not the case? Yes. Now, because so it means we are within payments if you paid up to June. Okay, we are within. Ideally, there will be delays to the extent of obviously to April and May. Ideally, because facilities will have to submit up to May. But because we now have the money, we are asking them to submit June so that we can pay them June. So we are ahead of payments.
Oh, so you're rather asking them now.
You
are now going ahead of them.
We are now going ahead of them. So if we have solved that problem, where the delays are no more, do they have to charge our clients?
Depending on the availability of medicines.
We will come there. You see, we will come there. You see, we have a contract with you that you will stock your pharmacy, okay, and provide services for our patients. We have paid you, and you are telling me that the medicines are not there. That is why the e-pharmacy will address that.
Who directly supplies medicines to the hospitals? Government, or they will contract suppliers?
Yes.
So they find their own means of getting the medicines into the hospitals. Is that what you're saying?
No, they take it from the regional medical stores.
Regional medical stores.
Yeah. So, well, you see,
stocked by who?
We have different types of facilities. So if you are private, your supply chain will be different.
Okay.
If you are government or quasi-government, your supply chain will be different. Now, me, the purchaser, okay, my focus is that I have a contract with you, the service provider, to provide services to my clients, okay, which is the Ghanaian people. I have paid on behalf of the Ghanaian people and even anticipated to give you advance. Your bits by providing the services, the medication, and everything for the patient to be satisfied. It is only when I am delaying in the payment that you can now come to me and say, why? But you have not paid me. And I'll say, oh, what is the problem? Then I'll tell you, maybe finance have not released the money. But this one, it is the reverse. Now finance have given me the money to pay. So from January to June, I have paid. So the facilities must also do their bit. But like I've said, they've told me that the tariffs are too low as one of their challenges. under the framework contract, the tariffs are too low. So what we are doing is that a team is actually reviewing the tariffs now to make sure that it commensurates with the current economic circumstances.
Yeah, so you're going to review it, adjust it upwards?
Adjust it upwards. But the team will have to, the experts will have to advise us. It's always covered in the 2024 budget, so there's no problem on that.
But before that, when we pay claims, you have your formula, and then you also have the law, the acts that protects revenues that come in. We've had issues of how you don't receive your revenues. In a few past periods, there was 0% of revenue coming into your coffers as the act actually requires. So there's so much even within the revenue generation situation. And if we haven't solved that, how do you justify, increasing or adjusting your tariffs upwards?
Okay, so there's a solution to that, and I'll tell you. Let's go systematic so that the viewers or your Ghanaians will understand.
Right.
Let's take it. We'll come there. But let's take it from when I said that we paid our parts and the facilities must also do their part.
Okay.
The illegal payments. Okay. Now, so the tariffs are too low. By our act, we are supposed to review the tariffs once a year. Now, we are proposing to government that government should introduce what we call the automatic price adjustment.
Yeah.
The automatic price adjustment is where you review the tariff frequently.
Have you proposed that already?
Yes, so it's been captured in the MPP's manifesto as we speak.
Okay.
So the automatic price adjustment will allow independent tariff review committees to review these tariffs and implement it effectively. But what this means is that this must be anticipated in the budgets.
Mm-hmm.
And like I said, we do have that leeway to put a percentage on our budget almost every year to care for some of these issues. So there's no problem. That's why, because the act actually anticipated we will do the review once a year. So if you look at this year, I think we put between 20 to 30 markup. Sometimes the money is not even spent.
Okay.
You see, on the claim, sometimes it's not spent. It's just there for, obviously, to address those issues. So this 2024 budget, we have plus 20 to 30% that will cater for the increase. So it was anticipated. So the automatic price adjustment will allow, in fact, it will give the facilities some guarantee that even if, depending on the economic circumstances, you see, they will have a guarantee. So they will not have any moral right to charge the patient, because at the end of the day, we guarantee for you that when prices go up, the independent tariff review will review and will give you your markups.
Yeah.
Okay. So why would you now charge our clients? You will not. So that's one of the solutions to curbing these illegal payments. Okay. The other point is on the enforcement. Okay. Once we are able to put this e-pharmacy in place and also implement the automatic price adjustments, we believe that the facilities will have no moral right to charge. We will form a coalition, Ghana Health Service Track and the private organization, private sector, which is the private facilities, to enhance monitoring and evaluation in such a way that the facilities will have no option but to comply with the law. Yes, because at the end of the day, we are paying them. So, like I said, we've dealt with the delays, which now we are paying. The e-pharmacy will come and help in terms of the digital architecture. Then the enforcement will set in. These three will curb the illegal payments.
How soon is the e-pharmacy system
it's been rolled out in a pilot form now. It's been rolled
Where?
In the northern part of the country. In fact, currently, as we speak, my team just returned from the northern region. Then we're going to do Volta and I think Eastern. Yes.
Since we're talking about digitalization, I may want to may want you to comment on the short code registration.
Okay. So the short code registration. So if you dial *929# then that's the integration. So again, let's look at something. So we want to achieve universal health coverage. Now, to achieve universal health coverage, we believe that the NHIS hold the key to achieving the universal health coverage, and I'm going to explain. So you see now we are integrating your NHIS card with the Ghana card. From 50 years and above, you can dial the *929# and integrate your card. We looked at our database and we realized that there was a loophole, there was a gap.
Mm-hmm.
So those between the ages of 6 and 14 were missing out. So instead of going to produce our Ghana card, instead of going to produce the card for them, the NHIS card for them, we said no. Let's link up with NIA again through Dr. Baumia's office. We link up with NIA and we said that we're going to use the money that we have to produce the cards for the 6 and 14 years young people who are on our database. So we ceded the money to NIA to produce the Ghana card for these cohorts. We have about 6.3 million of these young people.
But why will you do that?
Yeah, that's what I'm saying. It will help NHIS achieve universal health coverage. It will help Ghana achieve universal
That's
health
okay.
coverage.
I mean, we may want to achieve universal health coverage, but why will you want to use revenue that NHIA has generated to cater for the sick to go and produce cards for persons between the ages of 6 and 14?
In either way, we are going to produce the cards for Ghanaians for free. The cards we are going to produce for Ghanaians.
The NHIA cards. Okay.
And we are doing the integration. So what's the point in wasting the money on our cards rather than doing it for
persons who have not been captured?
Or that's for 6 to 14s. One, this is what it does. You kill the cards. Our cards last for just 3 to 5 years.
Mm-hmm.
So you kill that expiry canker. I'll put it. So what this means is that the Ghana card lasts for 10 years.
Mm-hmm.
So you need 10 years for the Ghana card to be renewed. Okay?
Yeah.
And our card between, I think, 3 to 5 years. So you do not really need our card, basically. Then it also saves cost because government do not have to now put more money to produce the cards for the 6 to 14 years because NHIS is paying for it. Okay? Now, the Ghana Health Service is doing number at birth. So now, if you are born, you are given the number at birth. So once we do that, so we've covered from 0 to everyone.
So whenever.
And by that, you only have to remove the small cost component, which is the 8 cedis that you have to pay to become a member of the scheme, and you are. So with the Ghana card, once you remove that financial barrier, which is the 8 cedis, you have already achieved the universal health coverage because everyone will now be having access. You see, so it's an easy formula, which we are working on seriously. In fact, we've started the pilot for the Ghana card for the 6 to 14 years, and very soon we will launch it nationwide to do the mass registration for the students. And that's for the young people. We are targeting school implementation, so we're going to the various schools to do that. In fact, in our NHIS offices now, we work collaboratively with the NIA. We have integrated the database, SNITS, NIA, and NHIA, and also the housing registry, that is Ministry of Gender. Now, if you want the indigents, all you have to do is just to go on our platform and you get them, those LEAP beneficiaries. And this is what? Digitalization. You see, now, for SNIT contributors, we noted through this that they were being cheated because they were paying twice. So you pay your 2.5% from your pension or your pay, then you still have to go and pay the ACDs before you are registered to become a member of the scheme. So we are now automatically onboarding SNET contributors to be automatic members of the NHIA, again, through digitalization. So what this means is that your insurance will be cheaper, because if we cover 95% of primary healthcare diseases, what this means is that the private sector companies can buy the top-up of the 5% that we do not cover, because we also regulate the private insurance. So they are only paying for the 5%. So your insurance is because NHIS already pays the 95%. You get what
I get it.
Yes. So all you have to pay for is the 5%. So that's one benefit. Now,
I actually wanted to ask that, for if you consider the private insurance service for the providers and what government is also providing, do you think that you'll be better off as compared to the private providers in about 5 years? You as a government or as a government institution, you provide better service compared to private service providers?
You see, it's all about efficiency and leadership. You see, for me, I think that once we put these reforms in place, the system will work. See, we've been talking about Europe, America, and all these countries. See, their development is anchored on digitalization. Okay, so it's the efficiency of the systems. And this is what we're trying to achieve. You see, Ghana's development, to me, and where I sit now, especially if you take it from the health context, is anchored on digitalization. Last 3 weeks, I was in the UK. I met the NHS executive management. They told me, when I was telling them on our digitalization agenda, they told me that they will have to adopt that. I'm telling you, they told me they will have to go that way. And today, as we speak, just yesterday, some announcement came through. When we finish, I'll show you the evidence. You see, so it is really the case that because our development is seriously anchored on digitalization. In fact, I would say that we've been in digital darkness for over 60 years of our development. And this is the time. This government has actually brought it to light. The NHIA and the health service is also taking advantage of it, to the extent that now you have medical records. See, I was in a consulting room in the UK with doctors, advising them on contraindications of medications. Okay. Now, what this means is that when a patient comes to your facility, they do not need a folder. All they need is their NI card. And this is what we're driving. Okay. And I think it's so crucial that the Ghana card holds the key to our development and our digitalization agenda. And I'm hoping that Ghanaians will buy into this, because it's really the way forward. You see, digitalization. Yes.
Right. So just this part that we touched on is to eradicate illegal charges. That's one of the four key points that Dr. Abuaji intends to use in, enforcing some radical changes within the NHIA sector. Let's take a quick breather. We'll be back and continue with the other key points that he also intends to embark on. We'll be back shortly. We're discussing 4 key prong approach he wanted to use to make changes within the authority, and we touched on eradicate illegal charges, which he touched on the digitalization bit, and also how to improve on claims or delays in payments, how to eradicate it totally or reduce it to the barest minimum. So, well, my question, let me talk about the claims, and because the claims really, and your revenue generation will help sustain the insurance.
Okay.
What's the state of it now?
Okay, thank you so much. Let me say that the insurance continues to grow. So in 2016, our budget was about 1.2 billion. Today, as we speak, our budget is about 6.8 billion, about sixfold. So what this means is that it is not about the revenue, but it's about the receipts from finance and controller. So we've made some proposals to government. You see, there are so much bureaucratic processes in the way the money is received. Now, you go and buy something, you are charged NHIL. Okay? It goes through to the consolidated account after GRA's evaluation. Then the Minister of Finance will issue a warrant. Then the warrant will now be processed by controller before controller transfers the money.
Makes the allocation
to the NHIL account.
You suggested an act.
Yes. So this is the proposal. The proposal is that once GRA evaluates it, the money should go directly to the NHIL account. And I think we continue to dialogue with government. And I think if you look at the automatic price adjustment as has been proposed, all has been encapsulated in
the acts proposed.
Not in the reforms currently being proposed, which has been captured in the MPP's manifesto. But what I'm saying is that it is not about, it's a country something. So this is what will help the country, because at the end of the day, if you are getting the money from GRA through the NHIL account, even in capping, we are doing 6.8 billion. Imagine if the money is coming directly to the NHIL. That one automatically, you release, the cap is gone by this reform alone, and you get all the money. So what this means is that you get more money to pay claims, you get more money to onboard more diseases, you run it efficiently. So that's the meaning of what I've just said.
So what's the state now today?
Oh,
with release
now, let me be honest with you, it's been good.
Because now you say you are now ahead of the...
We are now ahead of payments.
Of
receipts. So let me commend the Finance Ministry and Controller for obviously adhering to our call. And also, we are social insurance scheme. So once monies are released to us, it goes to the heart of benefiting the vulnerable in society. Now, as I was narrating, we've paid claims to the extent that in our 20-year history, NHIS is now calling on facilities to bring claims to pay. Is it not remarkable? In our 20-year history, for the first time, in fact, just last week, as I said, the 2016 budget was released to us, 800 million Ghana cedis. It's huge. So we'll continue to improve it. We continue to advocate. And I salute the president for obviously...
for making changes in the finance ministry.
Please. So I commend him for the work that he's doing, because at the end of the day, this goes to his credit. He's an incredible leader and he's achieved a lot. And for me, we really have to consolidate the gains of this MPP government. Where I sit, everything that I've talked about, I can see the future is very bright. Should we continue? It's consistency. And I believe that we will get there. I was part of the COVID task force, and I saw the president chairing this task force day nine with innovations. All he did was to assemble the best in the country to help execute the agenda. But when I traveled to Europe, they asked me, how were you able to manage your COVID? Were there any white people in there? You see, so that tells you. And if you look at the assessment, we were one of the countries that topped in some areas. So we did remarkably well. We did really, really well. And I think
let's stay within the hospital.
Yes.
With all that you're trying to do, the ultimate is to give the best of healthcare to the people. a lot of the times you find persons complaining. Today we have very poor healthcare delivery services in hospitals, which you've had people, publicly share their experience of how they lost their loved ones to negligence in the hospitals. So as you are doing all this within the sector to make sure that we get the best, people go to the hospitals and receive next to zero service provision. And it's almost like you will have to beg a nurse, beg a doctor. Somehow, sometimes they even administer wrong medications too. I know that it falls directly under health ministry, which you also are within. So do you have any, plan to foresee some of these things?
Let's take it this way. You see, I've always said that, like I've told you, these reforms are work in process. You see, now the delays are no more, okay? If you talk about quality of care, okay, it embodies a whole lot of stuff, okay? Now, in the NHIS, what should we do to support the health service in such a way that they become efficient in delivering of their service? And this is where I'm saying that, you see, there are a lot that we can do. In fact, if you look at our act, we are supposed to provide access to Ghanaian population. Access can be defined in so many ways from healthcare point of view. So, for example, I'll veer to the dialysis. So the dialysis, can we now look at obviously a cheaper option of the dialysis where maybe the NHIS buy equipment for various facilities in such a way that running of it or the facilities will have it for it to be cheap. When you do that, what this means is that it reduces our cost burden.
Is that why you're going into dialysis care, you say?
Yeah, no, I'm just giving that as an example. But you see, it's not only that. So currently, we looked at our budget, okay, and we look at our cost burden. Now, hypertension, diabetes seems to be our cost drivers. These falls directly under what we call the non-communicable diseases, and which the world has described it as the next pandemic, okay? So to address this, we as health leaders cannot sit down for this to be obviously to catch up with us. So the NHIS, together with Ghana Health Service, check at the private facilities, have taken a bold initiative to launch what we call the annual health check for all Ghanaians. So the annual health check is for all Ghanaians. And what this does is it allows every Ghanaian on their month of birth to go to any health facility that has been credentialed by the NHIS to check their BP, to check their sugar level, and to check their height and weights. You see, and we are doing this under what we call the promotive preventive healthcare, and this has attracted international attention. I've been invited to seminars, I've been invited to make presentations. In fact, yesterday the World Bank was here to throw support to the program. USAID was here to throw support. NHS England invited me to England to throw support for the program. You see, now this will reduce our curative cost burden, because at the end of the day, our forefathers told us that what? Prevention is always better than cure. So definitely, if you go on that route, the incidence of diseases will reduce because it will be detected early, number one. Number two, in the Sustainable Development Goals, we have what we call the health and wellness. It addresses the wellness component of the Sustainable Development Goals. And you see, this will not be done in isolation. We are encouraging the Ghana Health Service Health Promotion Division to take it upon themselves to champion good nutrition, like fruits, 5 a day, fruits, like the various exercising. Public education must be increased in this arena. We are in consultation with the Ministry of Agric to veer into what we call planting for fruits and jobs.
Really?
Fruits and veg. Yes. That's what the grains are what will let you live healthy.
But you see what Galamsey is doing to us, don't you? Are you not worried as NHIA?
We'll come there. Let me finish my points and I'll come there. You see, so if you veer into planting for fruits and veg, okay, more people will get vegetables to what? To eat. Now, we are also encouraging them, the Ministry of Agric, and the Ghana Health Service and the NHIS to introduce what we call the Meatless Monday, because Now,
The what?
The meatless Monday. So it means that one of the days, on Mondays, nobody in Ghana should take meats. It should be vegetables.
I'm very excited about these things you're mentioning. Because I'm one person that I've always been, in fact, when Dr. Kubo was here, I once asked him that don't you get worried seeing a number of people who are bleaching as an NHIA boss? Because you know the end result of bleaching. Some of the treatments that you are paying for in the hospitals are caused by directly bleaching. We now have the situation of people going to what, I don't know what they call it, Botox and things. I don't know. Body enhancement things. There are medical doctors, international level, have advised people, well, if you want, they will do it for you, but they've advised the consequences and the medical dangers associated. But we are looking on. We see all these foods on the markets, polluted with dyes. We say red oil is polluted with some dyes that Food and Drugs Authority come and tell you, oh, this is bad, don't eat it. But NHIA is quiet and still paying for claims.
You see, so it boils down to the fact that, you see, the healthcare architecture must change in this country. It must move to preventive healthcare and curative, not only curative. So that's why in our 20 years, if we're focusing on the curative, that's why some of us are put there to also inform government on the way forward. And I think the point I'm making, see, we've started. You see, we're not a government that we just looked on. At least we're starting somewhere. And I've just told you, this policy alone, okay, is able to now bring on board the preventive healthcare as part of the claims of the NHIA, which will, like I've told, it will early detect diseases, okay? It will reduce our claims, because at the end of the day, the diseases will be detected early, and we do not have to spend on it at the early stage, on the later stages, okay? We will be achieving the universal health coverage through this, and we will also be addressing the wellness component of the Sustainable Development Goals. You see, so all these things are good. And these, let me say, these are not theories. These are practical things that we are implementing. But you see, some of these policies do take time to manifest. So if you are not careful, you will think that we are not doing anything. But we are doing significantly, we are doing a lot. We are doing a lot.
But things that focus on preventive must be easy to implement, you know? Like planting for fruits and what? Veg. Yes. And things like no meat day. That is very, is what's it called, low-hanging fruits that we can just pluck.
Under the One Health, let me say that I was chairing the ECOWAS board for disease surveillance and control, and we have what we called the One Health program. Under the One Health program, those are the things that we want African governments to champion. And I think, like I said, Ghana, we are taking the initiative to launch, to start it. And we have actually started. So if you go to the Ghana House, we have the One Health platform, where we bring the animal sector, the health, and the environment sector to obviously champion this. So I think it's work in progress.
One Health.
One Health. One Health.
When is it going to start rolling out?
We started One Health about 2 years ago.
And what is it? What does it do? I haven't heard of it. This is my first time actually hearing.
Oh my
One
God.
Health.
Okay. So the One Health approach is what I've told you about. So, because diseases from animals obviously gets into human beings.
Yeah.
So it started. That's one of the approaches, is the meatless.
Then I think the buzz around it is very.
I think we must all come together as a country to support it. And let me be honest with you. The health committee in Parliament supports this. So when we went to Parliament and we told them about this, certain allocation, I think about 3 million was given to NHIS to actually start. So which means that, and when it went to the floor,
the One Health?
No, the preventive healthcare. When it went to the floor, no one rejected it. In fact, both sides, they all said, no, this is a good. In fact, to the extent that her opposition was the one championing this for us. Haruna, and I've forgotten the name. But I mean, all that I'm saying is that, to say, it's for the collective good of the country. So the collective good of the country.
How did you allocate the funds for the 3 million that you received?
Oh, so it will be channeled through the.
It's 3 million Ghana cedis or dollars?
3 million Ghana cedis. It was just for the initial preparation and the pilot, you see. But what I'm just trying to say is that from 2025, preventive healthcare will be part of the claim system of the NHIA, because at the moment it's only curative.
Yeah.
Okay, but because the board has accepted it, it has gone through Parliament, so we now have the mandate to cover it in our claims.
So how is Preventive going to also kick in claims? They are preventing. So what are you claiming?
Okay, so that's what I said. So the annual health check. So preventive healthcare is
or
also
the programs.
broad.
Okay. Maybe the programs
yes.
you put in place will require.
Yes, will require that they claim for it.
Okay.
Because they are providing the service.
Yeah. Okay.
And this is where we also want private sector to take advantage to boom their business. Because at the end of the day, like I said, the 5% can be covered by the various insurance companies because we cover 95% of the diseases.
All right. Comment on Galamsey.
Okay, so the fact is, we as a country need to obviously depoliticize the Galamsey fight. Illegal mining is obviously not the way to go. Legal mining is what we want, because at the end of the day, if you are doing legal mining, like the community mining schemes, which most countries do, I believe that our waters will not be polluted.
I'd rather you stay away from community mining scheme.
No, wait, I'm making a point.
Because the point is,
I'm making a
the
point.
Community mining scheme, or most of the people who have collected licenses from it are failing in applying the way they have to.
I'm making a point. You see, what I'm just saying is that let's as a country come together to fight. What is Galamsey in a way? You see, for me, okay, what I'm just trying to say is that legal mining is what I support.
Everybody does.
Legal mining is what I support, because you cannot tell, the mining should obviously go on, but it should be done properly. So what I see here is we have to strengthen the monitoring and evaluation aspect of that, where obviously, because my understanding is that we don't have to mine in water bodies. So that's not the case. So it boils down to implementation of the policies,
the legal framework.
The legal framework. Okay, so I'm not an expert in that area, so I don't really want to delve into.
I know. It's just about the claims, and like we were talking about preventive. People are bringing all kinds of diseases for you to take care of it, and as we sit today, almost everything is polluted. Our water, our food, everything.
I have said that I support legal mining. And the legal mining that I support is what will help us, not illegal mining. All that I'm saying is that we should strengthen the monitoring aspect of the legal mining in such a way that it may not be illegal. Because at the end of the day, we have people in there to do the monitoring and evaluation. So I believe that is what is lacking. And I think that as a country, that is what we have to go. But you see, politicization of it is not going to kneel to our benefit. That's why I have desisted from politicizing it. The thing is, we need to encourage legal mining. There are various ways you can do that. Most countries use community mining. Even in Europe, it's the community mining. But it's the policing of the community mining that is crucial. Do you get it? Yes. So I believe in legal systems of operation. Yeah.
My point is, everybody believes in what you believe in.
Yeah.
The legal systems. But obviously, we're seeing the opposite. But I know that if we're not able to curb the situation, it puts pressure on you, being the CEO of this institution. Definitely, you will have to be now taking care of more kidney diseases, as we're already having, receiving reports from the Ghana Health Service and other institutions. That is the pressure. In fact, when they gave us the report about the kidney disease, I was worried about NHIA.
Okay, let me tell you something. You see, for NHIS actually cover the acute renal disease. We cover that. What is happening now is, since when I came in, dialysis, or that is the end stage of renal diseases, became very topical.
Yeah.
So immediately I had a meeting with the vice president, and he said that he needed to inform his boss about the discussions we have had. So we were looking at how to make sure that we cover dialysis
Renal.
on a benefit package of the insurance scheme. So we commissioned an actuarial study, because before you add something on our benefit package, there should be a sustainability analysis that should be done.
Yeah.
But that sustainability analysis cannot be done in a vacuum. It takes time. So that committee was obviously formed and is currently still working. But we needed a measure, an immediate solution. That's after the committee's report, then we can. So we took it to, after the discussions with the Vice President, I went to the Health Committee, then I made a proposal to them. And they also accepted that, yes, renal diseases or end stage should be catered for, so the dialysis treatment must actually be catered for. So an allocation of 2 million was given to it.
Yeah.
But because when I came in, the budget had already been done, there was no place to take the 2 million for. So we needed to veer in our corporate social responsibility budget. That second committee was chaired by Dr. Insiansari, with all the teaching hospital directors and the CEOs on board, because they normally offer the dialysis because of how special it is. So when they came, we judged up and we saw that, okay, the 2 million could take care of the vulnerable, which is people between the ages of 18 and below, and people above the ages of 60. So we could give them all their 8 sessions of the dialysis free of charge.
Yeah.
Million. So there was another age bracket missing, between 19 and 59. So we said that, okay, let's still deep in our corporate budget and see what we could. When we did the analysis, we noted that the cost for them is actually 2 million. So the first one, the allocation was 2 million, but we got 2.4. But when we did between the ages of 19 to 59, giving them only 2 sections per month, we got 2.4. So we added that 2 million to the 2.4, and we got 4.4 from our corporate social responsibility budget. And we reformed the authorities. And this is how come today the dialysis is actually being run. And we are paying for 8 sessions free of charge for persons 18 and below and 60 years and above, and 2 sessions for people aged 18 and 59. Now, the program has actually been running very well. Now, the facilities are appealing to us that since the introduction, it has been, they've had increase in cases.
Of the care.
Of the,
the introduction of the care.
More, with the introduction of the care. More
patients are coming.
You see, so that's one
so
of the
you
good
see the
side.
problem you're faced with.
So that's one of the good side. So
the good side that patients are coming?
Yes, that is so that you treat them.
Oh, that they are opening up for you.
Opening up.
Okay.
Yeah, because at the end of the day, people may be dying slowly without
accessing any care.
But now that they are coming for care, for me, and
it's a good thing.
It's a good thing. We have also proposed in the NPP manifesto that I think access should be providing basic equipment to facilities in such a way that it will come back to reduce the cost for the NHIA. So if we look at the NPP's manifesto, it is in there that when we assume power in 2025, we are going to provide some basic equipment to health facilities through our acts, the access that I'm talking about. And one of them will be the dialysis, obviously, machines.
When you assume power, you're in power now.
I mean, there will be a new government. That's why it's a proposal.
Yeah, but you see, you are in office. You have ideas. You are not sitting on your ideas, are you?
No, I'm not. Because I've told you, look at this proactive. I've been in 110 days.
Yeah.
110 days.
I'll appreciate it better if I see that, for example, the dialysis machines that you are saying that you want to get some in 2025 should you win elections.
Get it in 2025. I said that we have put it in the MPP's manifesto, but we've also heard that the ministry, because that was the next point I was coming to. We've heard that the ministry is now making arrangements to give Kolebu and some of the pharmacies some dialysis machines.
Okay.
I personally have had proposals from Konfanoche, Efia Kwanta, that they need dialysis machines. So I'm also, through the partners, the development partners, in consultation with them. So it could be that it will yield results. You see, so I look at possibilities of obviously helping. And that's my mentality. I believe that it is possible for us to do, not to wait till we win the election. So the action should start from now. This is why we have taken this bold initiative to introduce the dialysis, even pending the bigger actuarial, so that we really know. So we believe in, let's do it now. Aside all the odds, we have been able to implement this. Let me tell you one good thing. You see, normally, patients will go to the facilities, and when they go, the facilities will now bring the claims for us to pay. You know what we did? Today, as we speak, we gave them advance payments for all the 6 facilities. NHIS, through government, has given them advance payment for the dialysis treatment. That is why the noise has actually gone down. We've paid up to September ending.
But you don't call it noise.
But the agitation, when the agitation came...
It's not noise.
Okay, so that's why you stopped that. I'll correct that. That's why the agitation actually stopped.
Yeah.
You see, but what I'm just saying is that, you see, the fact of the matter is that we are being proactive. We are not just sitting on the fence. We are just taking proactive measures in such a way that we address the situation. I always take it from, obviously, a holistic approach to doing things, because once you do that, then, like I say, diseases do not know political colors. These dialysis do not know NDC, NPP, or CPP. And I told you that it was supported by Parliament. And I also told you that it was even the opposition that even mounted the campaign. So the fact of the matter is that as a country, if we come together, we will definitely resolve our problems. You see, and giving you this because I'm privy to what is in the NPP manifesto. That's why you see me diving into that. But again, I believe that these things will go a long way to help. So for the first time, we have been able to give advance payment to facilities to deliver budgets, to deliver services. It's remarkable.
So we had 3 different prong approaches that we specifically I didn't mention, but I think we've touched on some of them. Reduce NHIA ICT cost, enhance NHIA benefit challenges, which I'm sure we touched on. But the benefit challenges, what is it about?
Okay, you're talking about the benefit package.
Yes.
Okay.
So I mean, yes, the benefit package.
Payments.
Yeah.
So what we are saying is that, you see, as we are paying, the patients must also enjoy the benefit package that we are providing them. So we are encouraging facilities not to charge our clients.
Okay. Then we also have the institutionalization of mandatory NHIA cards.
Okay. So we want, I've touched on it a little bit, but I think I'll go back. You see, we want as a country, we want the Ghana card to be your NHIS card.
The universal card.
The universal card. Because with that, it's easy. Your Ghana card can have your medical history, can have your medical records at the back end, so that doctors who are supposed, because it has a chip in, so all you have to do is just to
key in.
To keep key in, and you see. So you do not have to carry a folder.
In fact, when you were talking about earlier, I was thinking, okay, so the collection of all these many cards, you know, it's we will have to get to a point where we consolidate it all into one.
Exactly. And that's where we, from health, we are taking the initiative. You see, you talked about the NHIS cost or the ICT cost.
Yes.
Let me be bold and say this. You know, the initial infrastructure of digital things are costly. Okay. But when over time, okay, So as you institute it, you will see that as you go on, the cost will reduce. But what the next phase is what we call the internalization of those services. So you now train your experts, or you now train your personnel to be experts to now handle them. That's how it goes in all countries. That's how it goes. But because we are in the initial stages of it, okay, that's why maybe some people will say, "Oh, your administrative cost or your ICT cost is too high." And all those things. But you see, over time, it will come down. See, if you ask my
Are you
staff,
promising us that?
of course. If you ask my staff,
I mean,
asked them, no, wait,
as time goes on, things increase. Costs of things increase.
No, but you have already instituted the architecture of it.
Okay, so you don't need
you don't pay for it. You don't pay for the infrastructure again, but you pay for the services. You see, but if you listen to Dr. Bawumia, when he spoke at UPS, he said we'll be going into leasing of equipment. You see, and these are things that in the advanced country they do to make things cheaper. Do you get what I mean? So all that I'm saying is that for health, we are also taking on board a lot that will improve the health service. And I believe that Ghanaians should know and obviously buy into it because it will help us going forward.
We touched on the children's enrollment. That's what you said. You were even trying to use your own funds to get the children enrolled. How successful was that? It was okay. It was successful.
Oh yeah, it's successful. So now we waiting to do the mass one because the students are on vacation. So once they come back in September, I think middle of September they come to school. We will launch it, and once we launch it, then we will do the mass registration in schools.
So overall, you would say that we are on the right path when it comes to NHIA.
I can assure the Ghanaian population that the NHIS is on a very good footing. The gaps are being addressed, like the co-payment that I've talked about. In fact, in 2016, the membership of the NHIA was about 10 million. 2023, we had grown to 17.8 million. We've added 7.8 million. We are in mid-year, and we are already doing 15-point-something million. We are in August, July. We are already doing 15.8 million.
Would you say that, well, the expansion is...
Our targets for the year of 20.8 million. I believe with these innovations that I have actually narrated, you will see that because now we are automatically onboarding SNITs because we have waived the HCD for them because already they were paying. So addressing efficiency also increased since membership. Now, the annual health check, okay, if it goes live, it will definitely serve as an incentive for people to go to. Let me now dive into my PhD. So when I was doing my PhD, Ghanaians were telling me that, some Ghanaians were telling me that they do not benefit from the NHI. Okay, they do not benefit from it. And I asked them why. They said, why? But we have to pay for it. Then when we are sick, we have to, but we are not sick. So now you are offering the Ghanaian people an incentive.
For paying without falling sick.
Yes. Yes.
Because
through the, no, not really, not necessarily that. Because now it's like they will benefit from the annual health check.
Okay.
So even if they pay, they benefited from the annual health check. You see, so that addresses the question of we were not benefiting. And automatically, now, once they are doing the annual health check, they will definitely be members of the scheme. So you succeeded in that. You see, but by our act, it is mandatory for every Ghanaian to be a member of the scheme. So with the Ghana card, as I've told you, from 0 to 5, from 6 to 14, as for the 15 and above, it's already ongoing. Every member will be a member of the scheme. That enhances our chances of achieving.
But we still have the very ineffectiveness of the system where people still complain about going to the hospitals and not getting the service they need as far as the card is concerned, right?
You are right. So that's why I said it's work in progress because you see, unless, it's going to be some few years that everybody will see some of these things that we are talking about. Like
About how many years?
Oh no, like I'm saying, the children, they are about 6.3 million. If we are registering about 3 million now, and next year we do 3 million, we've achieved that. Okay, and like I said, the zero to five, they are already benefiting. So, and the 15. Improvement in the scheme, because I believe that we have a lot to offer the Ghanaian people, and we've started well.
Let me ask again about the dialysis. How far you have gone? Is it sustainable for quite a sizable number of period, or what exactly is going to happen?
Okay, so
when we exhaust how much we're putting there?
The Ghanaian population is that the dialysis, as we are doing now, is going to continue. This initial phase gives us data. Okay, it gives us data to work on, to look at how we. In fact, let me also bring. You see, the numbers that were even presented to me earlier on. If you look at the actual claim, because we gave them the budget and we are tracking, it has actually significantly reduced.
Yeah.
Even though more people are seeking the service, the budget has actually reduced significantly. So initially we gave them about 537,000 Ghana cedis. The actual expenditure for June was around, is it for June? Yeah, for June was around 200 and something.
Okay.
So you see the gap. So I think it's only the actuals that we'll be able to use in projecting, even though in health economics you can use obviously some assumptions to project, and that's what we did. So facilities do have money now, and they are still utilizing the funds that we gave them, and they account appropriately because of the tracking systems we put in place.
So you just have to pay attention. Once you pay attention, you can reduce some of these inefficiencies.
That's what I'm saying. That's what I'm saying. The key to reducing that is the digitalization, because at the end of the day, now we have the verification machines at the various facilities, where even when you go to the hospital, we will ask you to put your hand on the verification machine. Then we get feedback here. So the initial investment in there seems to be expensive, but it will come down. You get what I mean? And we are doing a pilot in some facilities. So once we roll out nationally, you will see that our cost will reduce significantly, to the extent that now the annual health check, we're going to use AI technology in deploying it. You're going to use AI, artificial intelligence, in doing that.
In deploying what?
In deploying the annual health check.
Okay. I will want to understand how that will be done. I'm curious. Yeah.
Okay. So again, you see, like I'm saying, we are working out the system. So the board approved that we should obviously use artificial intelligence in reducing our claims burden. So we will be integrating that.
Okay, that makes sense.
Operation.
Okay. I actually tried to follow up on some of the awards you've received this year. I mean, just this month or last month. There was Ghana Medical Diagnostics Excellence Award. Yes. Congratulations on that. And then I think in September you had Excellence in Health Award 2024 by Ghana Nigeria Achievers Awards Foundation. What exemplary did you do to receive these?
Okay, so thank you so much. So you remember I was telling you that I wear many caps. Currently, I chair the African CDC board for risk communication and community engagement. Just about last month, I was the chair for the ECOWAS risk communication and community engagement for disease control. And my international profile is also solid. In fact, when you come to my house, I've won a lot of awards since 2016.
How many?
A lot, some countable.
Give me a number, a range.
A lot.
20, 30, 15,
you see,
10.
Honestly, a lot. But
when you at a glance, how many do you count?
You see, I'm saying that it's a lot. But to come to Ghana in 2019, during the period of COVID in 2020, and to receive the Order of the Voter was one of the humbling moments. Because you see, I'm very young.
Yes.
And to receive that at
Order
that
of
age,
Merit.
to me, is remarkable. So in all the awards, that is what really touches me a lot. And I did it when saving lives, when I was trying to help the country. And I must say that, yes, it's good. But even, from 2019 to now, I can count up about 6 or 7 awards, prestigious ones, not the ones that they are prestigious ones.
Not the ones that we buy.
I don't know. I'm being honest. The institutions are very credible, and I don't have to put in any effort. They just award, and I think people follow my work. When I put something on social media, I think it goes very far. Not only Ghana, because of the various positions that I hold. So it does go very far. But what I can assure you is that I'm doing this work not for any award. I'm doing it to support the vulnerable in society. And if so be that I'm awarded, so be it. I'll continue to try continue to work hard to make sure that the Ghanaian population do benefit from my leadership. That's all I'll say. But yes, I've had quite a significant. I don't know how to put it. You see, I'm not even able to express myself well in that, but I've had quite a lot of awards. Yeah. In 2016.
You had awards?
A Young Fellowship Award. So I'm a fellow of the Higher Education Academy of England and Wales.
Oh, wow.
Yes.
Oh, congrats.
Thank you.
Oh.
So I've had, they are uncountable. In 2021 or 2022, I got the National Award to be Gold Award to be the best health worker in. I'm just imagining it as you are saying, but I've had a lot of awards.
You appear to be hardworking, now CEO, or a hardworking health worker.
Yes.
Thank you for your contribution to the country.
Thank you so much.
And we thank you for opening your doors to us as well.
Thank you.
Right. When we need some more answers, we'll come to your door.
Please come. I'm ready. I'm ever ready. I don't shy away from obviously communicating what we are doing. At the end of the day, you have to communicate what you are doing for people to know what you are doing and also for it to benefit the system. So anytime that you need any clarification or anything, just come. My doors are open. I'll avail myself to the media to be able to hold the work that we are doing as well. We thrive on transparency. That's my hallmark. I thrive on transparency and I follow processes.
Our next program with you will be visiting Galamsey sites. I'm sure you'll go with us. All right. So that's the time we've actually spent with the CEO of the National Health Insurance Authority, Dr. Dacosta Aboagye, telling us more about the insurance scheme. And as the insurance scheme grows, we'll also find out more. And as and when we have some more questions, definitely, as he says, we'll come to his doors and he'll open them to us. My name is Ania Fampo. Thanks for watching.
Metro TV, insightful and inspiring moments.